Dan, thank you. WCAX investigates kids in crisis, waiting in the emergency room for days, even weeks, for mental health treatment.
Hundreds end up in the ER each year around Vermont for psychiatric help, and most go home. But when they need a higher level of care, that's when we found the bottleneck begins. The Vermont Department of Mental Health says last year, 52 kids who were considered a danger to themselves or others had to wait for placement. Their average stint in the ER was about 3 days. The department doesn't have the numbers for families whose children sought help on their own.
And as you can imagine, the ER can be an overwhelming place for a child. And while everyone we spoke with agrees kids shouldn't be waiting in the ER, when asked how to fix the problem, no one had a clear solution.
Kathleen Zoni spoke with a family who says they are frustrated by a system that they believe is failing. She joins us now. Kat.
Well, Darren and Celine, the mom who came forward to share her son's story with me, says she did it because she wants to shine a light on a problem that puts her family and child in danger, and to let other parents struggling to get mental health care for their children know they're not alone.
He's a fantastic kid. He is creative and athletic and just like, he's funny.
Caitlin Ray loves her son. The 11-year-old plays basketball and adores his pet hamster. But she's asked us not to show his face because he struggles with mental health issues. Serious enough that police and crisis responders have had to get involved. Is the system working?
The system is not working at all.
She says they want him to get treatment. He's already been through the Howard Center's Jarrett House and hospitalized at Brattleboro Retreat. But last month, he ended up in the ER again. And Ray says he waited there for a bed to open up at the retreat for 13 days.
It's an emergency room, and it's meant for emergencies. It's not meant for people to sit there waiting for, upwards of 2 weeks for some sort of treatment.
And at the end of it all, she says Brattleboro Retreat decided not to take her son, leaving them back at square one. What does it feel like when you get to the ER and you've been waiting there for a week, up to 2, and then you find out that you just have to take your child home?
It's very frustrating and it's heartbreaking. You can get something fixed, or you can work towards getting something fixed. It's a positive thing. And then to be told that that's not going to happen, it's really devastating.
Psychiatrists say the longer a child waits to get appropriate care, the worse the mental illness gets.
It's frustrating for everybody.
Dr. David Ratu is a child psychiatrist and medical director for the Department of Mental Health. He says Vermont has good clinicians and good integration of mental health care between the school system and primary care. But
we are absolutely struggling in some areas.
He thinks kids are waiting in the ER for too long. Brattleboro Retreat is the only in-state inpatient option for Vermont's kids. I dug into the numbers and found that there are 30 beds at the retreat for kids, and they're split between 2 age groups. Brattleboro Retreat tells me they had nearly 800 youth admissions last year, many of them repeat visitors. When I asked them if they think the state needs more beds for kids in crisis, they said it's hard to say. That's because last year they had about 11,000 bed days available for youth. About 9,500 of them were actually used. So in theory, there should be 4 beds available each day. But the retreat says the reality is the demand for mental health treatment goes up and down, so some days there are no beds available and other days there are several. Many of the mental health officials I spoke with, though, say they believe there is a need.
The bottom line is I think we probably do need some more acute care beds.
Dr. Ratu says stronger outpatient care would likely help shorten wait times, too. That's where the Vermont Department of Mental Health is focusing.
Expanding our inpatient capacity is urgently important, but it's not the only answer.
Commissioner Sarah Squirrel says adding more beds is not the only fix. Her department is looking at several solutions, including intervening earlier with children, strengthening mental health services in public schools, strengthening outpatient programs, and addressing stigma. But she says they routinely hear from families who are struggling in the system and wants parents to know they are listening.
These stories are heartbreaking from my perspective.
Caitlin Ray says she wants less talk and more action.
Things don't move very fast.
Because each day her child isn't in treatment puts him and the rest of her family at risk. What has been the scariest moment for your family so far?
It's every time that I feel completely helpless. When I know what's best for my child and I can't do it.
The mental health department is in the middle of an evaluation process mandated by lawmakers to assess how Vermont's mental health system is working. Right now, they're doing a listening tour around the state to hear from patients about what's working and what's not and develop a 10-year vision. They are planning to have that done for the next legislative session. Darren and Celine.